Kia ora, my name is John Parsons and I'm the Associate Dean of Postgraduate Research based at Moturonga, the Faculty of Medical Health Sciences. Our faculty is based at the modern Grafton campus across the road from Auckland City Hospital and the beautiful Auckland Domain. Since our beginnings in 1968, we've become internationally recognised as a comprehensive medical and health sciences faculty with a reputation for research excellence. As the largest biomedical research faculty in New Zealand, we have a proud history of attracting and growing preeminent researchers, talented students, and attracting research funding. We're also advancing the mana of Aotearoa as a global centre of health learning, research and innovation, enhanced by Māori knowledge. As a future postgraduate student, our aim is to help you uncover your potential and to be equipped with the knowledge and skills that are needed to positively influence the health and well-being of individuals, whānau and our communities. You'll be taught by lecturers and researchers at the top of their fields in world-class training facilities and have the opportunity to make lifelong connections with fellow students along the way. Many of our staff have contributed to significant discoveries in modern medical and health knowledge, and our graduates are employed in some of the best hospitals, medical and health centres, laboratories and biotech companies in the world. Choosing a postgraduate qualification will provide you with the ability to explore new and emerging fields of study and the opportunity to gain specialist knowledge. If you're looking to advance your skills, deepen your knowledge, specialise in a chosen field, or explore a new direction in health, these are just some of the reasons you might consider doing postgraduate study. We offer a wide range of postgraduate programs to help you reach your goals and flexible course options, whether you're currently studying, currently working, looking to upskill, or even change your career path. In fact, many of our postgraduate students complete their studies part-time due to work and other commitments. We offer both research and taught programs and cover the fields of medicine, nursing, medical sciences, pharmacy, optometry, population health, and a variety of science disciplines. You can choose from over 50 subjects across more than 30 programs, including postgraduate certificates, diplomas, masters, and doctoral qualifications. And a feature of many of our programs is that students may often move from or progress from one qualification to another. There are many reasons you might undertake a postgraduate research pathway. You could be looking to deepen your knowledge about a particular field of study you're passionate about, to advance your career, to contribute to society, or to unlock new discoveries that improve the health and well-being of people in New Zealand. If you've just finished your undergraduate degree, are in the workforce, or are considering returning to study, a research degree allows you to start or continue your research in a field you're passionate about. From masters and honours degrees to PhDs and named doctorates, we offer a comprehensive range of options for postgraduate research and supervision. As mentioned, there are over 30 postgraduate programs you can choose from, and the faculty also offers 3 doctoral programs: the Doctor of Philosophy, the Doctor of Medical Sciences, and the Doctor of Health Sciences. The core of a postgraduate research degree is the successful completion of a research project, where you'll be expected to plan and manage and deliver your research project under the guidance of a supervisor. Research masters are completed by thesis or a combination of taught courses and a thesis. They offer the opportunity to follow your research passion while developing advanced research skills. Our faculty is a research powerhouse and hosts 4 university research centres, including the Centre for Brain Research, the Centre for Cancer Research, the Centre for Co-Created Aging Research, the Centre for Pacific and Global Health, as well as dedicated faculty research centres and a Centre for Research Excellence focused on heart health. Research is conducted across 6 schools and numerous research centres and our research teams in these areas provide nurturing and highly supportive postgraduate training in an innovative learning environment. As a student, you will have the opportunity to work on innovative projects and ongoing research in these areas. Some of these areas might include brain research, cancer research, nutrition and dietetics, pharmacology, aging, disability and rehabilitation, vision research and population studies, to name but a few. You can search our online database, Discovery Profiles, for information about our research experts and their current supervision opportunities. And to support you in your studies, there are a range of scholarship opportunities and funded projects that you can apply for. Health professionals are in high demand across Aotearoa, so now is a great time to advance your education and build a rewarding health career. From clinical care, scientific research to health policy, education and promotion, our graduates are highly sought after and work in a huge variety of roles as part of the country's health workforce. Many of our graduates obtain senior roles within hospitals and healthcare centres. Others work in pharmaceutical and health promotion or internationally in globally competitive research groups and in specialised biotechnology industries.
Kia ora. My name is Andrew and I am the Student Support and Engagement Manager based at Mātauranga Hora, the Faculty of Medical Health Sciences. I lead the Student Support and Engagement team. My team and I work to support you through your whole postgraduate journey, from your first orientation to the hand-in of your PhD thesis. Our friendly student support and engagement advisors make themselves available to work one-on-one with you to help you overcome all those challenges that are part of student life. Our main goal is to support your health, well-being and success. Not only do we want you to thrive in your studies, we also want you to thrive personally too. We run events. We link you with clubs and societies. We facilitate seminars and workshops, all because we want to make your student experience as enjoyable as possible. There are many reasons to be excited about being a postgrad student at our faculty. Aside from the varied and exciting study options, of course, there is a great opportunity to connect with your fellow students through a range of different forums. Uni is all about making connections, some of which will last for life. This is still true, perhaps even more so in the postgraduate space. Our campus is continually buzzing with activity and events that you can be a part of. From inter-faculty events to career workshops, from competitions like the 3-minute thesis to research conferences like HealthX. You can find something you'll enjoy. In our faculty, you can join and get involved in some amazing communities, such as the Postgraduate Students Association, also known as the FMHS PGSA, who run monthly coffee socials, regular pub quizzes and board game afternoons. Grafton campus itself is an incredible place to study. You'll be in a campus solely focused in the health space. You'll be surrounded by medical professionals. We even have Auckland Hospital right over the road. On campus, we have our own student hub, where you can go for information and support on admission, enrolment, examinations, graduation and more. And dedicated library services where you can enjoy free study workshops and get all the learning essentials to help you succeed. And if you ever need to take a breather, you can head to our cafe on site or pop across the road to the Auckland Domain and enjoy some fresh air and sunshine. There is so much to love about postgrad study at the Faculty of Medical and Health Sciences. We'd really love to see you here with us.
Kia ora e te whānau. My name is Amanda Kirk and I am a MAPAS Student Support Advisor at Mātauranga Hora, the Faculty of Medical and Health Sciences, Waipapatau Mātarau, University of Auckland. MAPAS Postgraduate Support provides a caring environment where students, whānau and staff are committed to academic achievement within a Māori and Pacific context. MEPAS postgraduate support is designed to assist and support our Māori and Pacific students during postgraduate study. We offer varied resources, activities and opportunities during your postgraduate study. What type of postgraduate support does MEPAS offer? All MEPAS postgraduate students within the faculty can access the following support services, which are designed to help students succeed within their course of study. MEPAS postgraduate workshops for academic writing, study and research skills. We also hold writing wānanga as retreats for MEPAS postgraduate students to focus on their mahi, away from home and outside of formal teaching space, to minimise distractions. We also offer targeted tutorials, which may be arranged for specific courses, where MEPAS postgraduate students need additional support to understand the course content. Another amazing incentive that we hold are cohort get-togethers, which provide an opportunity for MEPAS postgraduate students to get to know each other, to whakawhanaungatanga, and to network with fellow postgraduate students. MEPAS postgraduate students have access to specific online resources to support them in their mahi, and support and guidance to explore and apply for postgraduate scholarships and funding. There's also assistance to access key support services, such as student health and counselling, student learning services, spiritual and religious support, Tuakana Network, student disability services, and the examinations office. For more advice and information, please feel free to reach out to one of our team. We're here to support you on your academic and cultural journey. Come and join our whānau.
Kia ora koutou. My name's Andrew, and I'm the Student Support and Engagement Manager here at the Faculty of Medical and Health Sciences. Today, I'm joined by Stian and Fabi, who are two of our current postgraduate students. They're going to share a little bit of insight into their university experience and what it's like to be a postgraduate student at the faculty. Thank you so much for joining me today. So can you please tell me a little bit about yourself and what inspired you to join us to study at postgraduate level?
Sure. I come from South Africa and I did high school there, and I got really interested in studying the heart. So I came to the University of Auckland for my undergrad and studied a bit of biomed here. And I just heard the researchers talking about their research and their hypotheses, and it just really captivated me. So I decided it's something that I thought I would pursue. And
here you are.
Yeah,
great.
Here I am.
Great, thanks, Stian. How about you, Fabi?
Well, I have a bit of a different journey because I'm a bit elder than most of my colleagues. So we migrated from Brazil in 2016, and my husband got a job here, so I stayed home because I had 2 kids. And then I was like, what should I do with my life right now? You know, I was over 40, thinking about coming back to study, but we weren't living in Auckland, so I pursued other degree in another place. And then there was any scholarship available. And I knew a professor here at the University of Auckland, but I never thought that I'll be able to get that scholarship. But she was really nice. We had a coffee, and then she said, you really should apply. You have an interest topic. And then I applied for scholarship last year and decided to continue my studies. Yeah. Now that the kids are grown up, it's my turn.
Amazing. Thanks, Fabi. So, Fabi, can you tell us a little bit about the research that you're undertaking?
Sure. I'm based in population health, and I'm investigating the intersection of being a migrant woman in New Zealand and coming to this drinking culture. So I'm interested in migration, drinking cultures, and the use of social media. So the aim of my research is really to understand what's going on if you come from a different country, specifically from any Latin America country, which has a different drinking culture, and then arriving in New Zealand. And also how the social media plays into that. If you are seeing alcohol advertisement, if you're seeing people posting alcohol, and how that impacts or not on your drinking behaviors.
That's really interesting. And how about you, Stian?
I'm based in the Department of Physiology, so I'm studying essentially how the brain communicates with the heart. So I'm really interested to see how that communication can go wrong, and then if we can learn more about how that goes wrong, if we can then restore it and try and improve heart function.
So what's been the most rewarding part of your journey so far, Stian?
I think it's working on a problem that you really struggle with, and you keep sort of throwing stuff at it, and then eventually actually you figure out the problem and you solve it. So for me, like I needed to get a very particular kind of recording done, which has never been done before. So being able to like get that recording done and going, oh, my project is fine, and being the first person to be able to do that was really cool and really interesting. And so I think, yeah, when sort of a problem gives way and you find that solution, I think is what I quite enjoy about postgrad study.
Great.
So you can just keep doing that over and over again.
Thank you. And Fabi, same question.
Okay, so I think that what's really rewarding for me, first is I never thought that coming back to study at my age and after so many years of working, I have worked in hospitals, medical labs, so sometimes we think, oh, I'm too old, it's not for me. So I felt so well received and welcome and part of the community that I ended up being one of the co-presidents of our Postgrad Student Association, the PGSA. That's how we have met. And that's been really a highlight of my journey. And research-wise, noticing that my research can really inform public health, it's something that's really close to my heart. And yeah, it inspires me to keep going.
Right, thank you. So Fabi, you've already mentioned that you've got children and a family. How do you balance that other life with your research and your studies?
Yeah, at the beginning it was quite tricky because I was living in Wellington and I needed to move over here. So we decided that I would move by myself, which was pros and cons, because it was good to have a bit of time only for myself also after so many years. But I call them kids, but they're not really like kids. So our youngster is 20 years old and our elderly, she's 28 and she's in Portugal doing her master's. So I have an amazing husband who always saw my passion for studying and he's like, well, if that's what you want to do, I'll support you. So he stayed with our youngster in Wellington. I came here and then he moved up here and now it's just the two of us. So to be fair, there's not too much balancing. It's more like, oh, this is great. 50s are much better than I thought.
And how about you, Dean?
I think one of the benefits I found about postgrad study is that it's a bit more flexible than your typical sort of 9 to 5, I guess. I find I tend to work a bit better in the very early mornings than I do in the later afternoons. So depending on what lab you're in and what project you're doing and what kind of study you're doing, you can adapt your schedule a bit. So I tend to come in very early in the morning and then I've got the whole afternoon off to sort of do whatever I want unless I've got a few other uni-related commitments or something like that. So I think the added flexibility is quite helpful for balancing work and life. Yeah.
Great. And how about you, Fabi? What are your views about the flexibility of being a postgraduate student?
Oh my God, to me, it's really the best part. You're totally right, Steve, because I'm the opposite of you. I'm not early morning person, so I usually arrive around 10, but then I stay later. And also I have agreed with my supervisor that I really didn't want to feel overwhelmed. To be fair, I was really afraid of doing a PhD because a lot of people that I know said about how stressful it is, how you get, really overwhelmed. And I really wanted to take it differently. So my supervisors told me, Fabi, just go slow, take breaks. So I think that I also grew personally because I'm learning that taking a break, it is part of it.
Yeah.
So yeah, I think that's really good.
Great. So leading on from that, Fabi, what advice would you give to somebody who's considering postgraduate study at the Faculty of Medical and Health Sciences?
Just do it. Don't overthink it, because when we are planning things, our mind plays tricks. So it's really easy to think, why shouldn't I be doing that? But trust yourself. Talk to supervisors, go into the university website, look who's there, what research are they doing, email them, book a coffee. I mean, my whole process was so smooth that you wouldn't believe. It was really, I booked a coffee, had a chat, left it with a kind of idea for a proposal, apply for the scholarship. So yeah, just believe in yourself and do it.
Okay, thank you. And how about you?
I can't really say it better than Fabi just said it. Yeah, you're very right. All I'll add is just, I think you need to find something to get excited about. Postgraduate research isn't going to be easy the whole time. There'll be times that it is tough. And so look around at different researchers, like Fabi said, look at what research they're doing. And if it's something that excites you, go for it. Or if you think, oh, I'm sort of tangentially excited by this, but something else could be a bit more exciting, email that supervisor and talk about that project and see if you can build your own project that you could be really passionate about. Yeah, just find something you're passionate about, I think, is the core advice I'll give.
Great advice from both of you, thank you. So how do you want to make a difference to the future of healthcare in New Zealand?
Well, my end goal is hopefully that my research has some tangible outcome. So, like I said, I'm studying this disease called heart failure, and there's millions of people around the world who have it, and quite frankly, we don't have enough therapies or good therapies, especially for the kind of heart failure that I'm studying. So I hope that I can contribute to the bigger sort of corpus of knowledge of this disease, and then maybe give myself or future researchers some targets that we can try and improve how these patients live their everyday lives and make their quality of life a bit better.
Thank you. And Fabi, same to you.
I really think that migrant health is under-researched still. So I think that my major contribution is adding knowledge to a group that is underrepresented, and that help us to inform better or more cultural appropriate healthcare in New Zealand. And on top of that, I just fell in love with being a researcher and being the university environment. So I'm looking forward for having maybe the possibility to become a research fellow or a teaching fellow and continue doing research that's relevant for our country.
That's great. Thank you both so much for your time today. Some really insightful comments from you both. I hope you've enjoyed hearing from our students about their postgraduate experience at Waipapa Matarau. If you'd like to learn more about postgraduate study and our programmes, you can get in touch with us at auckland.ac.nz/ask us. Visit our programme pages on the university website, or pop into our student hubs to speak with our expert advisors. We look forward to you being part of our Health Whānau.